You've memorized murmurs, mastered meds, and survived simulations. But can you handle the real NCLEX traps that test your critical thinking? Let's dive into 20 high-yield cardiac questions that separate safe nurses from exceptional ones. Keep track of your answers and drop your score below. Let's see how many you crushed today. Question 1. Digoxin toxicity risk. A client with heart failure taking furosemide and digoxin reports nausea, dizziness, and blurred vision with yellow halos. What should the nurse do first? 1. Administer the next dose of digoxin. 2. Hold digoxin and check serum potassium level. 3. Encourage a high-sodium diet. 4. Increase the client's fluid restriction. The correct answer is 2. Hold digoxin and check serum potassium level. Detailed rationale. 1. Administer the next dose. Worsens digoxin toxicity. The client's symptoms, GI plus visual, are textbook toxicity. 2. Hold digoxin and check K+. Furosemide, a loop diuretic, causes hypokalemia, which increases digoxin binding to cardiac tissue, which is arrhythmias. Holding the drug prevents worsening toxicity and allows verification of serum potassium and digoxin levels. 3. Encourage a high-sodium diet. Sodium worsens fluid overload and hypertension, contraindicated in HF. 4. Increase fluid restriction. Fluid restriction may already be prescribed, but it does not treat the toxicity mechanism. CliniqueRN Test-Day tip. Whenever you see digoxin plus diuretic, immediately think, check potassium before you give it. Low K+ means high digoxin danger. Question 2. Route of heparin administration. A client with a STEMI has the following orders. Oxygen 2 liters per minute. Sublingual nitroglycerin. IV morphine. IM heparin. Which order should the nurse question? 1. Oxygen 2 liters per minute. 2. Sublingual nitroglycerin. 3. IV morphine. 4. IM heparin. The correct answer is 4. IM heparin. Detailed rationale. 1. Oxygen is appropriate if O2 sat less than 94%. 2. Nitroglycerin SL reduces preload, improves coronary perfusion, part of MANA protocol. 3. Morphine eases pain and reduces workload on the heart. 4. Heparin must never be given IM, causes hematoma and unpredictable absorption. The correct routes are intravenous or subcutaneous. CliniqueRN Test-Day tip. Heparin should never be given by the intramuscular IM route. That's always a trick question. If an exam question states that heparin is to be administered intramuscularly, the correct action is to question the order. Question 3. Thrombolytic therapy complication. 3 hours after receiving alteplase, TPA, for ASTEMI, the client reports a sudden severe headache and slurred speech. What is the nurse's priority action? 1. Stop the infusion and notify the provider. 2. Administer acetaminophen. 3. Reassure that headache is expected. 4. Check the blood glucose level. The correct answer is 1. Stop the infusion and notify the provider. Detailed rationale. 1. Headache plus slurred speech means intracranial hemorrhage. The nurse must stop the drug and notify the provider immediately. 2. Pain management masks symptoms. 3. Headache is not expected this late, only mild during infusion. 4. Hypoglycemia can mimic neuro changes, but context, post-TPA, means brain bleed first. CliniqueRN Test-Day tip. After thrombolytics, every neuro change means hemorrhage until proven otherwise. Question 4. Beta blocker safety. A client on metoprolol has a heart rate of 48 beats per minute and feels lightheaded. What should the nurse do first? 1. Continue medication and monitor. 2. Hold the medication and notify the provider. 3. Administer atropine. 4. Encourage oral fluids. The correct answer is 2. Hold the medication and notify the provider. Detailed rationale. 1. Ignoring symptomatic bradycardia risks cardiac output collapse. 2. Beta blockers slow the heart rate. If HRR less than 60 beats per minute and client symptomatic, hold the dose and notify provider. 3. Atropine may be used in emergencies but not without provider direction. 4. Fluids don't fix conduction abnormalities. CliniqueRN Test-Day tip. Always check apical pulse before beta blockers. Mean, if it's slow, don't go. Question 5. Loop diuretic safety. A client on IV furosemide reports weakness and leg cramps. Which lab value explains this symptom? 1. Potassium 2.9 milliequivalents per liter. 2. Sodium 138 milliequivalents per liter. 3. Calcium 9.2 milligrams per deciliter. 4. Creatinine 0.8 milligrams per deciliter. The correct answer is 1. Potassium 2.9 milliequivalents per liter. Detailed rationale. 1. Hypokalemia causes muscle weakness, cramps, and ECG changes. 2. Normal sodium. 3. Normal calcium. 4. Normal kidney function. CliniqueRN Test-Day tip. Loop refers to lose K+. Always monitor potassium before and during therapy.
All right, quick break, because I need to show you something that can actually change the way you study for the NCLEX. This is our AI feedback system, built right into the QBank dashboard. After every quiz, you don't just get a score. You get personalized insights that explain why you missed questions, where your weak spots are, and how to fix them. For example, it tells you things like which subject areas need urgent review, whether you're rushing through questions and leaving test time unused, step-by-step recommendations like taking focus quizzes to sharpen delegation, prioritization, or clinical judgment. Instead of just saying you scored 60%, it literally gives you a roadmap to improve. And that's just one part of the QBank. You'll also get challenging NCLEX-style questions that test real critical thinking, a clean summary sheet that tracks your progress over time, and a built-in computer adaptive test system so you can practice under real exam conditions. This isn't just question practice. It's smart, AI-driven coaching that helps you study smarter, not harder. If you're serious about passing the NCLEX on the first try, check the link in the description and start using the QBank today.
Question 6. Heart failure priority symptom. A client with left-sided heart failure reports awakening at night gasping for air. Which explanation should the nurse give? 1. You may have anxiety attacks at night. 2. Your heart pumps less effectively when you lie flat. 3. You might be retaining fluid in your stomach. 4. This could be due to low blood sugar while sleeping. The correct answer is 2. Your heart pumps less effectively when you lie flat. Detailed rationale. 1. Misattributes a cardiac symptom to anxiety. 2. Recumbency increases venous return, pulmonary congestion, paroxysmal nocturnal dyspnea. 3. GI fluid doesn't cause shortness of breath. 4. Hypoglycemia causes confusion, not gasping. CliniqueRN Test-Day tip. If a heart failure patient wakes up breathless, it's fluid in lungs, not fear. Question 7. Post-CABG chest tube. A client, after CABG, has 250 milliliters bright red chest tube drainage per hour. What should the nurse do? 1. Continue monitoring. 2. Lower the chest drainage system. 3. Notify the surgeon immediately. 4. Clamp the tube. The correct answer is 3. Notify the surgeon immediately. Detailed rationale. 1. Monitoring delays life-saving action. 2. Doesn't fix bleeding. 3. Greater than 150 milliliters per hour of bright red output post-op means hemorrhage. Call surgeon stat. 4. Clamping may cause cardiac tamponade. CliniqueRN Test-Day tip. In a postoperative cardiac patient, a sudden increase in bright red drainage should make you suspect internal bleeding. Question 8. ACE inhibitor reaction. A client taking lisinopril develops swelling of the lips and tongue. What is the nurse's priority? 1. Administer diphenhydramine. 2. Assess airway and prepare for intubation. 3. Hold the next dose. 4. Document and monitor. The correct answer is 2. Assess airway and prepare for intubation. Detailed rationale. 1. Antihistamines may help, but airway first. 2. Angioedema means airway obstruction risk. Airway assessment and intubation preparation are the top priorities. 3. Too slow. Airway must come before medication adjustments. 4. Documentation delays life-saving action. CliniqueRN Test-Day tip. The suffix pril refers to ACE inhibitors, remembered by the phrase, a pill that can kill, because of the risk of angioedema. Angioedema caused by an ACE inhibitor should always be treated as an airway emergency. Question 9. Pacemaker malfunction. A client with a pacemaker reports dizziness. HR is 38 beats per minute. What should the nurse do first? 1. Document findings. 2. Apply transcutaneous pacing pads. 3. Administer digoxin. 4. Give IV fluids. The correct answer is 2. Apply transcutaneous pacing pads. Detailed rationale. 1. Documentation delays critical care. 2. HR 38 plus symptoms means symptomatic bradycardia that is immediate external pacing. 3. Digoxin slows HR further. 4. IV fluids don't correct conduction failure. CliniqueRN Test-Day tip. Brady plus dizziness plus pacemaker means prepare to pace, not wait. Question 10. Thrombolytic therapy complication check. After TPA for MI, which finding is most alarming? 1. Pink urine. 2. Oozing IV site. 3. New onset confusion and slurred speech. 4. Mild gum bleeding. The correct answer is 3. New onset confusion and slurred speech. Detailed rationale. 1. Expected minor bleeding. 2. Monitor, not urgent. 3. Intracranial hemorrhage sign. Stop drug and notify provider. 4. Minor mucosal bleed. Observe. CliniqueRN Test-Day tip. After TPA, any confusion means hemorrhage until proven otherwise. Question 11. Post-myocardial infarction MI complication. A patient 48 hours after an MI suddenly develops shortness of breath, a new systolic murmur, and pulmonary crackles. What complication should the nurse suspect? 1. Papillary muscle rupture. 2. Cardiac tamponade. 3. Pericarditis. 4. Dressler's syndrome. The correct answer is 1. Papillary muscle rupture. Rationale. 1. A papillary muscle rupture leads to acute mitral regurgitation, which results in pulmonary edema and the appearance of a new heart murmur. 2. Tamponade means muffled heart sounds, not murmur. 3. Pericarditis means pleuritic pain relieved by sitting forward, not new murmur. 4. Dressler's means autoimmune pericarditis weeks later. CliniqueRN tip. After MI plus new murmur means valve rupture until proven otherwise. Question 12. Cardiac tamponade. A post-cardiac surgery client has decreasing blood pressure, muffled heart sounds, and distended neck veins. Which action should the nurse take first? 1. Notify the surgeon immediately. 2. Increase IV fluids. 3. Administer a vasopressor. 4. Reposition the patient. The correct answer is 1. Notify the surgeon immediately. Rationale. 1. Beck's triad means cardiac tamponade, then emergency pericardial decompression required. 2. Fluids may temporize but don't fix compression. 3. Vasopressors ineffective, heart physically compressed. 4. Repositioning doesn't relieve tamponade. CliniqueRN tip. Muffled heart means muffled life. Notify surgeon, prepare for pericardiocentesis. Question 13. Beta blocker trap. A patient with heart failure is prescribed carvedilol. After the first dose, the patient becomes dizzy with heart rate 48 beats per minute. What should the nurse do? 1. Hold the next dose and notify the provider. 2. Encourage fluids. 3. Administer atropine immediately. 4. Recheck HR in 30 minutes, then give. The correct answer is 1. Hold the next dose and notify the provider. Rationale. 1. HR less than 50 plus symptoms means hold and report, titration needed. 2. Doesn't fix bradycardia. 3. Used for severe symptomatic bradycardia after provider notification. 4. Giving again could cause cardiac arrest. CliniqueRN tip. Beta blockers block the beat. HR less than 50 means hold and call. Question 14. Pulseless electrical activity, PEA. A telemetry monitor shows organized rhythm, but the patient has no pulse. What is the correct response? 1. Start chest compressions. 2. Defibrillate immediately. 3. Give amiodarone. 4. Check another lead. The correct answer is 1. Start chest compressions. Rationale. 1. Pulseless electrical activity, PEA, occurs when there is electrical activity on the monitor but no mechanical heart contraction, meaning there is no pulse. In this situation, cardiopulmonary resuscitation, CPR, should be started immediately. 2. Defibrillation for VF/pulseless VT only. 3. Amiodarone not useful in PEA. 4. Checking leads delays life-saving action. CliniqueRN tip. In pulseless electrical activity, PEA, first check for a pulse. If no pulse is present, immediately begin chest compressions. Question 15. Pacemaker malfunction. A client with a temporary pacemaker shows spikes with no QRS complexes following them. What does this indicate? 1. Failure to capture. 2. Failure to sense. 3rd, failure to pace. 4th, normal function. The correct answer is 1. Failure to capture. Rationale. 1. Spikes not followed by depolarization equals pacing impulse not captured by myocardium. 2. Failure to sense means spikes at wrong time. 3. Failure to pace means no spikes at all. 4. Abnormal tracing. CliniqueRN tip. Spike plus no beat means not captured. Check leads and patient first. Question 16. Digoxin toxicity. A heart failure patient on digoxin reports nausea, blurred vision, and seeing halos. Which lab value would confirm toxicity? 1. K plus equals 5.0 milliequivalents per liter. 2. Digoxin level equals 2.8 nanograms per milliliter. 3. Mg2 plus equals 1.8 milligrams per deciliter. 4. Na plus equals 135 milliequivalents per liter. The correct answer is 2. Digoxin level equals 2.8 nanograms per milliliter. Rationale. 1. High K plus may result from toxicity but isn't diagnostic. 2. Toxic level greater than 2.0 nanograms per milliliter. 3. Mildly low magnesium may increase risk, not confirm toxicity. 4. Unrelated. CliniqueRN tip. HALOS means hello toxicity. Always check digoxin level plus electrolytes. Question 17. Cardiac cath prep. Which statement from a patient before a cardiac catheterization requires intervention? 1. I'm allergic to shrimp. 2. I may feel warm when dye is injected. 3. I'll be awake but drowsy during the procedure. 4. I'll need to keep my legs straight after. The correct answer is 1. I'm allergic to shrimp. Rationale. 1. A risk of allergy to iodine or contrast dye may require pre-medication with antihistamines or corticosteroids, or the use of an alternative contrast agent. 2. Normal sensation during contrast injection. 3. Conscious sedation explained correctly. 4. Post-procedure standard to prevent bleeding. CliniqueRN tip. Seafood allergy refers to contrast caution. Question 18. Cardiomyopathy priority. A client with dilated cardiomyopathy has new crackles, dyspnea, and pink frothy sputum. Which action is priority? 1. Administer IV furosemide. 2. Obtain an ECG. 3. Restrict oral fluids. 4. Elevate legs. The correct answer is 1. Administer IV furosemide. Rationale. 1. In pulmonary edema, it is essential to reduce preload immediately, typically by administering a loop diuretic such as furosemide. 2. ECG secondary. 3. Restriction won't resolve acute fluid overload. 4. Elevating legs worsens congestion. CliniqueRN tip. Pink froth means flood in lungs. Drain it fast. Diuretics. Question 19. Endocarditis education. A client with infective endocarditis is being discharged. Which statement shows understanding? 1. I can stop antibiotics when I feel better. 2. I'll inform my dentist about my condition. 3. I don't need follow-up blood cultures. 4. I can resume all activities now. The correct answer is 2. I'll inform my dentist about my condition. Rationale. 1. Full IV antibiotic course is mandatory. 2. Dental procedures can cause bacteremia, which poses a risk for patients with certain heart conditions. Therefore, prophylactic antibiotics are required before the procedure. 3. Cultures confirm eradication. 4. Gradual return to activity. CliniqueRN tip. New murmur? See dentist before the damage. Question 20. Post-cardiac surgery electrolyte trap. A post-CABG client has PVCs and K plus equals 3.0 milliequivalents per liter. What is the most appropriate action? 1. Notify the provider for potassium replacement. 2. Administer lidocaine IV. 3. Increase fluid intake. 4. Continue to monitor rhythm. The correct answer is 1. Notify the provider for potassium replacement. Rationale. 1. Hypokalemia causes ventricular irritability, which increases the risk of dangerous cardiac dysrhythmias. Therefore, potassium levels must be corrected promptly. 2. Lidocaine treats but doesn't fix the cause. 3. Fluid won't fix low K+. 4. Observation risks VF. CliniqueRN. Tip. PVC plus low K means danger. Replace, don't just record. That was a solid cardiac workout, nurse fam. How many did you get right? Comment your score below, and if you learned something new, smash that like button to help others find this video. Subscribe and ring the bell. Your next 20-question NCLEX drill drops tomorrow. Head to CliniqueRN now for your daily test and keep sharpening those skills.